Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about the recent CMS tech company pledge. And thanks to Swaay.Health, Swaay.Health for sponsoring this episode. Be sure to join us at the Swaay.Health Live Marketing Conference, April 29th to May 1st, 2026 in Foxborough, Massachusetts, just outside of Boston. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. So, Colin, would you take the CMS tech company pledge?
I'm not sure I'm allowed to, being a foreign entity, but
that's true. I don't think Canadians are allowed. Okay,
I don't know if I'm allowed to take the pledge, but if I could, John, I would.
Oh yeah. So what about if you were a marketing director at a health IT company? Would you take it?
I would say I would give the following advice. I'm not sure what the downside risk is of taking the pledge or pledging to it. However, I'm not sure how much I would be investing in it because it's a bit unclear still for me.
Yeah. Well, I think that, diving right into the topic, but I think the downside risk is a little bit just being associated with the current administration. And so there's been a touch of blowback on that. And most of the people that were there are like, hey, this is a bipartisan thing that we've wanted forever. Every president has wanted this data sharing. So it's not so much supporting, this administration as it is supporting CMS and, the efforts to kind of address some of the interoperability and exchange issues that are happening in healthcare. So,
yeah. And I mean, I'll just speak frankly. Like, I think, my initial reaction when this first came out, I brushed it off as, oh, here's another attempt at interoperability. And it is. I mean, there's no sugarcoating it. It is another attempt at interoperability. But is it a good attempt? I would say it's probably as good as all the other attempts that have come out over the years and everything else we're trying to do. And you're right. I mean, this does not seem very politicized. Like it is a genuine attempt to try and make data a little bit easier, more transportable, a little more portable. So I got to give credit where credit's due. I don't think it's bad. Like I think it's actually an okay thing.
Well, and I think you and I both know Amy Gleason, and so obviously we're biased in some ways, but she does have a sincere intent to solve the interoperability problem. She has her own daughter who experiences it, so she knows it firsthand, and so I think there is a sincere effort on her part, and many others at ONC and CMS that really want to address this issue. There's been a bunch of really interesting write-ups, that have come out. I think one of the best is Brendan Keeler. Go dive into his. But, I think it was him that highlighted something that was quite interesting about, I think it was him, maybe it was someone else, but it's like, why did they do it this way? Like, why did they do a pledge? Why didn't they just back TEFCA? Why didn't they go to rulemaking? Things like that. And I think that's actually the answer. Is that if they would have done TEFCA, then they would have had to follow rulemaking. And that would have been a year out, 2 years out. And they want to move quicker than that. And they want to push it forward quicker than that. They want an announcement by July 4th next year. Imagine that, July 4th, Independence Day. That sounds like a Trump thing. Let's announce it then, or at least have it done something, meaningful progress by then, so they can announce it. And, it's going to be interesting to see which companies actually do something and which companies don't. Because on July 4th, the ones that aren't on the list anymore probably didn't execute what they pledged to do and didn't actually do something to improve the situation. And so they probably won't be there. And that will maybe even be the more interesting part. Not to mention the other part that's interesting is the companies that are like, I didn't get invited. We see a lot of that. And maybe they didn't do it as publicly as they are doing it privately. Like, why didn't I get an invite? I should have been there too. And I think the right answer to them is, who cares? The first list of companies is not that big a deal. The next one is actually going to be more important, i.e., I took the pledge and we did something.
Right. Yeah. And so, again, my initial reaction was this is great marketing. So kudos to CMS and the government for marketing it. But there is some there to your point. To me, I did see this as non-political. I did see this as an attempt to solve a problem that we've all recognized for a long time. Unfortunately, it's another layer on top of a pile of maybe ineffective, and if I'm being discourteous, I'll maybe call it other attempts at interoperability. So the jury's out in terms of how will this pledge really move the needle. And I think to your point, John, that's going to be the real proof. Is sure, it's one thing to take the pledge, it's another thing to actually implement and live up to the pledge that you're making. So will some companies do it? I think so, because I think they're going into this with the right intention. And I think others will find it a lot more difficult and a lot more challenging than originally anticipated and may drop out. And who knows, maybe the pledge and the standards and the requirements will change right over this next year. But
Yeah.
the one thing I will hang the hat on is, behind all of this, the team at CMS, there's a person there, Fred Trotter, right, who has been a champion for this for
Buddy.
a long time, right? Like, and Fred's been all about this. This is his thing. So I'm essentially putting my money on Fred, right? To say, okay, if he's behind this, there's got to be something more than just a fancy announcement. There's got to be some, I won't say teeth, but some meat behind this. So I'm like you, very curious to see how this is going to work out in a year from now.
Hmm. Yeah, I'm interested to see if Fred's involved in this. I think he's going to be more involved on the freeing up of the Medicare data and the Medicaid data and kind of having, the government be part of this pledge in some ways,
Yeah.
right? And helping assist them to do that. Jacob a Reader, I think it is, a writer. I always forget how you pronounce his name, former ONC interim director, I think he was in between two of the ONC directors and worked at ONC for a lot of years. His write-up was really interesting. It's worth a read as well. That he's like, pledges don't accomplish it. It's what CMS does next. That's what's going to accomplish it, which is it a penalties? Is it, incentives? Is it other things that they do to then push this forward? Although he did also acknowledge that these pledges are a time to bring everyone together and then get reaction and to get, understand, okay, what needs to be done to really push this forward. So it's not that it's, the pledge itself doesn't actually change it, but it does bring people together and get some feedback. So CMS knows what to do next to help push it forward. So, the other thing that's really interesting for me, kind of first reaction to this, is seeing what they chose to focus on. And, I heard, I think it was Jody Daniel, who literally wrote HIPAA and worked in the government for a lot of years, right? Like, she said something really interesting. She's like, hey, if we get a national provider directory and we get some identity management out of this, that will be a big win. Like just those two alone. And I think that was my reaction. It's like identity management's valuable. And if they can do a provider directory, which is really hard, by the way, but if they're able to do those two things, that would be a significant improvement, and we can consider it a success.
Yeah, I gotta agree with you on the identity management for sure. That was an interesting component of this. That's a key part of the pledge, right? Is to move towards a single identity to identify every patient that's in these records. So, yeah, if you can achieve that, then that's a huge step in both, not only for interoperability but also for fraud and for a whole bunch of other reasons, right? And we know there's reasons why it hasn't existed up until now, but I think there's general acknowledgement that okay, that rule, may need to go away, and maybe this is the group that's going to do it. I'm interested in your thought though, John, on the companies that actually committed to the pledge. Which of them do you think will actually have impact here?
Yeah. So the ones that I think are going to have the most impact are actually the data networks and the EHR vendors. And it's interesting because in many ways, just talking to some of them, at the Direct Trust conference recently, it was really nice that the Direct Trust conference was right after this announcement. We're recording right after it, but talking to some of them, the question they were asking in the hallways, some of these companies that were there in DC taking the selfies and whatever, right? Like they were like, okay, what do we do next? And kind of the answer is, well, it's what we were already doing, but we just need to do it faster, right? So, I think some of that is the message. And so they're already doing the exchange of data, but we just need to accelerate what they're doing, I think. And so I think that feels like the message that many of them, heard and saw, and we've seen Athena Health talking about every one of their providers being on TEFCA, and we have Epic said, hey, we're moving everyone over to TEFCA as well, right? And there was a lot of question, like, is TEFCA involved in this or not? Again, I think if they would have said TEFCA, then they would have had to do rulemaking. But I feel more and more confident that all of this is going to be on the back of TEFCA, and it's going to accelerate what's happening with TEFCA just much quicker, including public health, including Medicare, including payers. It was great to see payers on the list. I'm interested to see, do they dive all in, right? Like, I think the EHR vendors and data networks are. If the payers do, that's going to be a really big change, when you look at the list and the companies.
Yeah, I mean, I look through that list, and it's hard it's hard not to see companies like Epic and Oracle having a big impact. I mean, because they're just the biggest two players in that space. If they get in, if whatever they do is going to have an impact. So, I mean, it's hard to bet against them. I was interested to see the diversity of EHR companies that signed on to the pledge. Right, it wasn't just Epic and Oracle. There were, like you said, mentioned one, Athena. There's eClinical Works in the ambulatory space. There was Elation, right, which is more known for the direct primary care stuff that they do. So it's interesting. There's quite a diversity of the EHR. My money, though, is on the payer, because I think this hinges on whether the payers get involved in a serious way or not. And they have the potential to really make this, along with any interoperability initiative, truly successful, because they are sitting on very valuable data. They have never traditionally played well with others. And so if they get on board with this and live up to some of these things in the pledge, I think they could have the biggest impact here.
That's interesting. Yeah, I mean, I think it'll be interesting to see if they come on board. And what that's going to do is that will open up a lot of other non-treatment use cases.
Right.
So, I mean, if we were going along the path before, it was all treatment, and we didn't know what to do with the non-treatment. So if the payers get on board, the public health gets on board, we're going to get a lot of non-treatment use cases. And I think that will be a good thing. And that's what the industry is kind of demanding. That's what innovation is demanding, is being able to do some of those things. So I would love for that to happen. You know who I think is not going to make an impact in this pledge is actually the kill the clipboard. Like, I actually don't know that this is really going to kill the clipboard in any significant way. There's some great companies doing stuff there, but man, I just know how hard it is to kill the clipboard and how many nuances there are with so many different interfaces, and the way the doctor wants to see it and the way the patient enters the data and all that. I'm really skeptical. Like, are the EHR vendors gonna like create a new standard that allows these kill the clipboard, companies to be able to collect the data in a way, whether it's from the exchange or whether it's from the patient, and submit it in a standard way so that then, you don't go to the doctor and they don't hand you a clipboard anymore? I'm really skeptical.
Yeah, I'm with you there. A bit of a scratch your head on those companies, or why they were singled out, maybe is a better way to put it. I'm not surprised those companies signed on. Why wouldn't you? But bit curious why that whole group was singled out as a group, right?
Probably because they wanted to say you don't have to fill out a clipboard anymore. That was the soundbite they wanted in the news, and I'm like, good luck with that.
Yeah. I'm not sure that's the highest priority in terms of healthcare.
It
Now
would be
of
nice.
course, well, yeah, I guess, I mean, if you ask any patients, it is annoying, but would you rather have, good care? Would you rather have your data be portable? I think people will go, okay, fine. If I have to put up with a clipboard, I'm okay with that, right? To solve that one, I'll put up with this annoyance.
Yeah.
The conversational AI area is interesting for me. A lot of really interesting companies in there, typical names that you would find: Anthropic, Google, and Microsoft, and so forth. I'm not sure what they're going to be doing there.
I was
And
gonna say that's
right,
the question, right? Like,
like the only thing I thought of is, are they kind of getting involved in the whole identity management thing? Like, are they using AI somehow to identify this is actually the same person? But that's not what these companies do. None of these companies actually have a division or department that's actually focused on that. Although, pretty sure you can probably train an LLM or an algorithm to do it. But that was, to me, that was more of the, okay, we need some AI in here. So let's single those companies out. They are big names, and that makes the the announcement that much bigger. But I am kind of wondering, like, what are they up to in here? Like, what?
it's the
Um,
same with the diabetes ones, like what are they really going to do, right? I thought it was interesting that Albertsons companies were there. Where's Kroger? Kroger was at Health, right?
yep.
Like I thought they would be there, not Albertsons. So that's interesting that they care about health and they're involved. I actually, for me, I said all these big tech companies that are listed there, a lot of them, I call them eye candy. They wanted them there because they are big names, and this administration loves big names and big announcements, but I actually don't. I think they're going to be the ones that impact it the least.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're asking the question of whether or not this CMS pledge for interoperability is going to make a difference. This episode is brought to you by our sister publication, Swaay.Health. That's Sway with two A's, .health. And we're happy to announce that our Swaay.Health Live 2026 event is happening April 29th to May 1st, 2026 in Foxborough, Massachusetts. Head over to live.sway.health. And again, that's Sway with two A's, .health to learn more about this premier conference for healthcare marketers and communications professionals. So, John, is this pledge going to work? What's the impact going to be of this pledge?
It definitely has some momentum right now. So I wonder if we're biased in this moment. But I also think it is a clear indication of what CMS wants to do. It is interesting that CMS is leading this more than ONC. That's a bit of a shift as well that we're kind of seeing happen. And I think some of it will. I think they're going to make an attempt at a directory. I'm not sure they're going to be able to solve it, but like if anyone can solve it, it's CMS that has access to these providers and the data and all that. So I'm interested to see if they could solve that. That actually might ask the facts more than anything else if we had a really good directory to be able to use for it, right? And it'll be interesting to see, do they include the direct address in the directory, right? So that Direct Trust has a directory. Are they going to kind of syndicate and say, hey, Direct Trust, you have the direct message address, let's add that to the profile of the national provider directory, and there's other ones as well that they could include as part of that. So I think that could be useful. And then again, I think the identity management, that one feels like it's running fast. And I think the big winners in that are going to be Clear and ID.me. And they're both going big in healthcare, especially Clear. Clear's made a huge investment. So I actually think that all of us are going to have this Clear or ID.me login that, to be able to, log into this new infrastructure. And I think it'll be interesting to see how that plays out, especially because I think I actually have 3 ID.me accounts, but I don't know, that's a problem. I'm interested to see how it plays out for me. I only have one Clear, so that's good. But those are the two that probably seem like the most interesting to me. The plan finder, they've kind of played with that, but I'm not sure it's really gonna make an impact.
Yeah, I mean, I look at the impact of this pledge, and I got to be honest, I don't know what the technical or even the healthcare impact might be in terms of, is it going to achieve anything or not? It might, right? It's certainly got the bones of something that could be achievable. And as you pointed out, if they end up backing existing initiatives like TEFCA, if they leverage direct trust, if they leverage a lot of things that have already gone on, then I really think this could be something really good, because then they're not trying to reinvent the wheel. But if they try to go down their own path and forge a new thing, I'm very skeptical.
Yeah.
But I think the impact of this pledge, I'm looking at it very differently. I'm going from a political, from a general, uh, you know, policy making. I know this is not a policy, but I think that the impact of this pledge is a good thing for no matter what color you subscribe to, whether you're red or blue, because this is one of the few things that have come out that truly looks bipartisan. Like it looks like nobody really stuck their finger and put a lot of political spin on it. I mean, maybe the press release, but other than that, the what's here is actually pretty good. Like it's got some good thinking behind it. It actually does feel very equal in the sense of this is just something to improve this one aspect of healthcare that we all can agree is very bad and needs to be solved. So I look at this and go, hey, this actually may be a triumph of bipartisanism, which I'm
That's
hoping
interesting.
would be maybe the biggest impact of what this is.
Well, and it's fascinating to think about what you just said, which is this really is in line with the trajectory we were already on.
Right.
It's not like they're coming in and being like, let's do something crazy that doesn't line up with TEFCA and doesn't line up with the other interoperability and identity efforts before. Yeah, that's really interesting. I was just looking at one of them, like it says faster blue button data. I was like, it's not even anything like, it's nice to have it faster, but what impact does that have? But it had a little subtext. It said fire-based digital insurance cards. I mean, how nice would that be? I always lose the insurance card, and then we have my kids. My ex-wife has it. I have it. It's a pain in my freaking butt. Like, like I would love a fire-based digital insurance card and have that available and validated because that's why we need the payers as well. But that's interesting. I don't know how they're going to get there. Like, is that going to be voluntary and be like, hey, everyone, let's do all the fire-based digital insurance cards? That would be awesome. I think it would solve a lot of problems. It would solve that clipboard problem where you got to fill it out and be able to do it. So that would be pretty cool if they were able to do that.
So John, let me ask you this final question. Do you think this pledge is actually going to work, or should have CMS looked to a different approach for this?
Yeah, I think Jacob, former ONC interim director, was right that pledges are about visibility. It's about bringing people together to understand the problem. At the Direct Trust conference, there was this really interesting debate panel. I mean, Nora showed up with a uniform and a yellow flag for the debate. It was awesome, like a ref uniform. Anyway, but they discussed, should government lead or should private sector lead? And they actually debated like what is the pros and cons. And then afterwards, I think they actually shared the most interesting thing, which is what do you really believe? Like, okay, you debated this, but like, what do you really believe? And Ryan Howell's, from Karen Alliance, and he actually wrote "Killed the Clipboard." So it'd be interesting to see if he likes my idea that we're not killing the clipboard. But he described it well, where he's like, you kind of need the private sector to start and then the government to pour gas on that fire. So, like kind of the private sector needs to prove that it works in like a small way. And then the government can help to like accelerate what's happening so that everyone adopts it. And so hopefully this is kind of a precursor of that. Like, hey, private sector, let's try a bunch of these things. And then when they see it working, then they can add it to MIPS or certification or what, or some other, mechanism as well.
Yeah, it's a good point. I mean, it is that's a really nice metaphor, right? To say that government should be pouring fire on gasoline on something to ignite it, but maybe they're not the ones who start it. Sorry, I got that all mixed up, but you know what I'm talking about. I think pledges do work. You're right in the sense of there is initial splash that the people, and when the pledge is made, it's much like when people make pledges to alter their own behaviors or make a play, for their communities. It does work in the sense of it brings attention to something that needed some attention. I think maybe interoperability needed a little bit more attention because a lot of focus had fallen off of it recently. So not a bad thing. But I think pledges work only when the people who making the pledge actually do the work.
Mm.
And so I won't say you have to have a critical mass. I just think you need a couple of really high profile wins by the people who made these pledges in order to count this as it worked. That is all you need. Like, and so whether that's Epic or Elation or Anthropic or any of these companies, if one of them does something really good and lives up to the pledge, and other people can look at that exemplar and go, well, if they could do it and they weren't, beaten, they weren't penalized to do it, they weren't incentivized to do it, but they did it anyway. And boy, looking, they're reaping some rewards. That I think would be amazing. So
Yeah.
I don't think CMS has to win on every front. If they just win on a couple, I think you'd have to say this pledge was a success.
Yeah, and I think the question is, what does CMS do next? Like, who do they celebrate? And then once they celebrate them, how do they codify it so that others do it as well? And how do they incentivize them with carrots or sticks, right? Like, I think both can work in this case. But what's interesting is in some ways they're almost guaranteed to win because of everything that's happening with Tefka and the way Tefka's moving along. Because just take Epic and Care Quality. Care Quality is going to become Tefka. Like that seems pretty clear to everyone that's involved, I think. Care Quality does billions of transactions already. When those billions are now on Tefka, it's going to feel like a win, right? Like no matter what happens. So, to me, they're going to get some wins and they're going to be able to give some gaudy numbers. Let's just hope that's just the beginning and it blows well past it.
Yeah, and I think that's the key, right? Like, to be honest, I don't care if they co-opt someone else's win. A win is a win for interoperability. I don't care who gets credit or who initiated it. Just get the wins, right?
Makes them jealous.
Exactly. But to your point, again, I think it's a smart move if they continue down this path, if CMS continues down this path of leveraging what has gone before rather than try to replace it. Because I think if they try to do that, then we are just going to chalk this one up to another failed attempt down the road of trying to do something. But if they leverage direct, if they leverage Tefka, they do all those kinds of things, then yeah, I'll give them the win and I'll say this is effective. I also think, again, going back to the political, this could be a nice way to show, well, sometimes maybe you don't need to start with carrot and stick. Like you can start with, let's just try to do something, folks. Let's see what works, and then we figure out what the carrot and stick would be. And hey, what about that? Would be amazing, right? If we actually had evidence-based, incentives and penalties rather than people just throwing stuff out and realizing later that this was horrible, like the incentives and the penalties actually didn't work. So why not do it this way? We haven't done it like this way before. So
it'll be fun to watch.
It will be. And thanks to all of you who tuned into this episode of Healthcare IT. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my Health IT collaborator, John Lynn. Thanks for listening and have a great week.